Malaria is the most common preventable public health problem in Nigeria. Yet, it takes a lethal toll of 97% of Nigerians, especially children under 5 years of age and pregnant women. Nigeria accounts for a quarter of the malaria burden in Africa. Over 31 million estimated cases of malaria occur annually in Nigeria. 2 out of 4 persons having malaria in the West African sub-region live in Nigeria. 1 out of 5 deaths from malaria globally occur in Nigeria. Nigeria accounts for nearly 110 million clinically diagnosed cases per year, and an estimated 30% of children and 11% of maternal deaths each year are due to malaria. It is the commonest cause of absenteeism from schools, offices, farms, markets, etc., resulting to lower productivity. There is evidence of reduction in malaria prevalence in Nigeria. The 2015 Nigeria Malaria Indicator Survey indicates 27% prevalence, as against 42% in 2010 and 25% according to the World Malaria Report in 2019. This suggests that the fight against malaria is not over yet. It is against this background that the Catholic Relief Services CRS, in collaboration with the Federal Ministry of Health through the National Malaria Elimination Program under the Global Fund Malaria Grant and with partnership with Adamawa State Government through the Adamawa State Ministry of Health and the State Malaria Elimination Program, rolled out the distribution of over 2.8 million free insecticide treated nets to the entire population of Adamawa State in the bid to eliminate the disease. On 14th October 2020, government officials, health experts from both federal and state sectors gathered for a campaign flag-off for the distribution of insecticide-treated nets at the Government House Banquet Hall in Adamawa State. This campaign will embark on a 3-week-long exercise that would see the distribution of over 2 million insecticide-treated nets to over 5 million beneficiaries in over 1 million households across the 21 local government areas of Adamawa State.
In 2017, CRS worked with 126 partners. So you will agree that our mission and vision is to build on the capacity of local partners. And this we do to provide life-enhancing services to over 21.3 million people across 34 states of the 36 states of Nigeria, including the FCT.
CRS leads this effort to combat malaria at the start of the campaign. This monumental project will create a historic change in the reduction of malaria prevalence in Adamawa State, especially in children under 5 and pregnant women. The mosquito net distribution campaign is a statewide effort on a vast scale. 2.8 million ITNs were moved from the state stores to the local government area stores and to health facilities across the local government areas in Adamawa State. Despite the magnitude, a distribution project of this nature requires careful planning and a steady work stream to achieve the aims and objectives of the project.
The work stream is called logistics work stream. It's a work stream that is saddled with the responsibility of moving nets from the state stores to the LGA store, to distribution hub, and to the beneficiaries. That's our responsibility, and to document the process.
Prior to this time, I'm the person that received all the nets that was supplied to the state from the Global Fund through the CRS. I received them on behalf of the state, warehoused them, under the standard operation guideline, and I took the custody of all the nets prior to this time. Now at this time, it's being distributed to all the local governments from the warehouses, and so far they have reached all the local governments as at this point. We will also monitor from the local governments to the distribution hubs at the various local governments.
The impact of malaria in Adamawa State can only be described as a plague. In 2017, according to the Adamawa State Ministry of Health, malaria accounted for 70% of over 850,000 cases of reported fever in Adamawa State. Thus, the need for the ITN mass campaign to distribute nets to households to protect themselves from mosquitoes that spread malaria.
We did it in 2010, when we distributed about 1.4 million nets. We had it in 2017 when we distributed about 2.5 million nets. And now we are in 2020 campaign when we are expected to distribute close to 3 million nets. The strategies we have been employed in the past has been we mobilize people at the households by giving them net cards and then redeeming them at distribution points. But this time around, because of COVID-19, the strategy has changed. We are giving the mosquito nets at the households. We enter the households and give them mosquito nets.
The fight against malaria has been ongoing in Nigeria for many years. A vital strategy for malaria prevention is the distribution of ITNs. ITNs are the simplest and most effective way to prevent malaria. This is done through a mass campaign strategy. Zainab Ali, the Senior Manager Vector Control for the CRS, speaks more on the campaign process.
The mass campaign process is an activity that you need to distribute nets to the population in the state, but it has some stages of implementation. We have the planning stage, that is where we do an activity called the micro planning. The objective is to ensure we get data from the LGA and ward level, where we can now move those, use that data to actually operationalize the campaign implementation, so that we can quantify our human resources as well as the material resources needed to implement the mass campaign. Then after the micro planning process, we have the implementation proper, where we build capacity of the states, local government, and even the ad hoc personnel that will carry out this campaign, this net distribution in the state. So we normally come into the states. We started the activity on the 17th of September, where a team of National Malaria Elimination Program as well as Catholic Relief Services staffs came into the state and consultants to support the state and provide technical guidance in the campaign implementation. So this team that arrived the state built the capacity of the state LGA personnel on how to carry out the net distribution. Normally, the net distribution in the country is done using a strategy where you register beneficiaries within their houses. We go from door to door to do a household registration and issue them a voucher we normally refer to as the net card, after which the net will now be positioned in the distribution hubs. Those hubs are identified location where it is easily accessible to the communities for them to pick up this net. So they bring the voucher and exchange it for the nets. But this year, due to the COVID-19 pandemic, the process was modified. We had a strategy called the single phase door-to-door approach. This is a strategy where the nets were carried by these teams from the distribution hubs to the household. So they were moving from house to house with the teams, with the nets to distribute to the beneficiaries. And one thing to mention as well is we use technology. We have a strategy called cash and asset transfer strategy that was deployed for this mass campaign. Android devices were used to register the beneficiaries before giving them these nets when they went to their households.
Families receive one net for every 2 persons. Behavior change communication campaigns after mass net distributions ensure that households consistently use the nets in the right way.
When we talk about the technical work stream, we're looking at basically the processes that guide the campaign and specifically the trainings that go with the campaign. So when we're looking at the processes, we're looking at the mobilization, the distribution, and then the end process evaluation. And because we come into the state and we want to use state-based personnel to conduct the campaign, we have to train them so they know what they are going to do. And even though the campaign is just a short project of 2 months, it's very fast-paced. So we use a lot of personnel in an attempt to cover every single household of the state. That means we're working with the state personnel, LGA personnel, and even people from the communities, and they must be trained to have a good understanding of what we expect from them and perform their duties satisfactorily.
The Cash and Asset Transfer (CAT) platform is used to register beneficiaries, track training attendance, manage distributions, and monitor coverage. Digital Android devices improve accountability, data quality, and time required for mass ITN distributions.
So the CAT strategy is an acronym for Cash and Asset Transfer, and it is an innovation that uses technology to improve program implementation in Nigeria, one of such being Insecticide Treated Net campaign. We have successfully used technology to improve accountability and efficiency in ITN campaign in 9 states, and Adamawa will be the 10th state where deploying this new innovation. So what do I mean by accountability? With the use of technology, we're able to account for every net given to a household. In terms of efficiency, we can make informed decisions using real-time data. For example, we can track uncovered settlements or communities. In other words, households that have not been mobilized and given nets, we're able to track that sort of information.
CRS programming strengthens existing health structures and supports relevant stakeholders, especially state malaria elimination programs (SMEP), to provide oversight of malaria interventions and improve SMEP's capacity to monitor and evaluate malaria interventions and generate data to guide programmatic decisions optimally at the national, state, and local government area levels.
During macro planning, what we do, we provide a platform where all partners, implementing partners, come together to discuss on how the support will be for all the states that, of course, will be implementing campaigns. So it's at that process also that we develop manuals and tools for campaign. We also do macro quantification for ITNs before procurement is done. And we also provide support during what we call micro planning, which is the second phase of campaign. That is done to get the needs of the state. So we provide that support to get the exact needs of that state. Warehousing of ITNs. If you know the volume of ITN, you know what it means when you have warehouses that are enough to take all the ITNs that are coming into a state. So for Adamawa State, even before the nets arrived, they made provision of warehouses at states and at LGAs.
For the Adamawa State Ministry of Health, the crisis of malaria is of paramount concern. So when the CRS team arrived in Adamawa State to commence operations of distribution, the state government were willing to support in every possible means.
His Excellency showed a very high level of commitment. He was there in person actually conducted things, flagged off the distribution himself. And let me also add that the state funded the flag off, which is innovative. Previously the grant would normally do that. So it was quite interesting to see that the state took up that responsibility of funding the flag off and organizing the flag off, and it was really very colorful. The high level of commitment from the governor to Her Excellency the wife to the entire exco. So it was really heartwarming to see that. So they are blazing the trail for other states, and we are very proud of what the state has done.
Adamawa State has done a tremendous job. The government has really supported this activity. Normally, National Malaria Elimination Program and Catholic Relief Services are here to provide technical support to the states, while the state leads the campaign process. And the state leadership did a tremendous job in leading the process, while the governor supported this campaign by renting the warehouse where these nets were stored at the state level, and even the local government chairmen also supported with renting warehouses and fixing the ones that were not in good shape prior to the arrival of these nets. We've also gotten support from the state through the SBC activities, where we had the jingle airing done free on on some media houses. We also had a lot of phone-in programs. We had other different supports that we got from the state. We had security operatives also supporting the process in case there is any issue that we need them to step in and support us. They were readily available to do that.
We also did flag off that will tell people that the distribution has started, and then they see the governor supporting the campaign and even sleeping inside the net.
We are happy. The support we got in a whole from the Adamawa State government has been quite tremendous. And of course, this came to being because of the carefully conducted activities in the demand creation workstream.
The project implementation starts with a macro planning exercise at the national level, followed by micro planning at the state level. This includes the main steps to develop budget and timelines for the campaign implementation. During this period, advocacy visits are also made to various stakeholders within the state for support and effective implementation.
We have paid advocacies at the state level. We have also supported and technically monitored the advocacy visits that were also happening at the local government levels, and the stakeholders across board were carried along, and we are happy. Even at the community level, the traditional rulers, the religious leaders, they all supported the campaign. At some local government, we have stories where vigilantes were adequately used by the community leadership to provide security for our ITNs.
Even the press are not left behind, as they play a very vital role in sensitization and awareness. To this end, special interactive engagements are held with journalists from various media platforms.
I am here to attend a training on advocacy rising on the need to use mosquito net, treated mosquito net. Outside society, there are a number of people that are not using the mosquito, and they deem it necessary to involve media so that we can support them in trying to raise awareness on the need for people to really use treated mosquito net to reduce malaria scourge.
We will do more in ensuring that we give more, visibility to this program, and ensuring that more people, properly use their the insecticide treated nets. But above all, is to ensure that there are success stories, that needs to also be told.
Campaign materials are sorted out, ready for distribution to various local governments of Adamawa State. These materials are used to sensitize and educate various households on best practices for handling ITNs.
The materials include all the training material that we use for the cascade training at the LGA. It includes all the tools, the logistic tools, waybills, inventory control card, the the warehouse stock sheet. We also have tools we use for mobilization, which includes revisit cards, I9A, I9B, I9C. We have PPE materials, which we call personal protective equipment, including face masks, gloves, and alcohol-based hand sanitizer.
At the LGA level, we are using many means of communication to create awareness and to sensitize the public, such as the use of town crier and other interpersonal communications like health educators.
We developed this for Adamawa State. So during the household mobilization, door to door, where people, we call them MDTs, they go around from house to house, register people and give them nets. Then the health educator among them uses this, we call it handheld guide. It has how to use and care for the nets. So they use this to tell the people. So this is health education at households now. You're telling the people that when you get the net, you air it under a shade for 24 hours before you hang and sleep inside. When you hang it, when you want to sleep inside, you make sure that you tuck in the nets under the sleeping mattress or the mat. And then when you wake up in the morning, you roll up the net. And then when the net is dirty, they should wash it. Washing it is with ordinary water and mild soap. After washing, for it to dry, you have to put it under a shade to dry. And then after you have used it for some time, maybe there's a mistake along the line and it gets torn, that they should sew with thread and needle.
The ITNs, which have also arrived in the state, are sorted out, ready for dispatch to their various secondary storage and distribution points. While some destinations are within reach, others sometimes prove a difficult challenge.
The transportation aspect of the campaign, I can say very well that it's been challenging, and these challenges are not just peculiar to Adamawa State. We know that we have rough terrains in different parts of the country. We have places that are mountainous. We have places that if it rains, sometimes you cannot go through. So when we factor all of these things in, it helps us to get the kind of vehicles that we need and inform the personnel properly. And then security is also key, because we work hand in hand with the security aspect, with close collaborations with the state government and the malaria program team. So assessment has been very okay. It's worthy of the thrive. And we see that we're achieving good percentages, because people are able to move from one point to the other, move devices from one point to the other. So I say, on the average, it's been very successful.
The 2020 campaign for the ITN distribution took a different turn as the year witnessed the scourge of the COVID-19 pandemic. The planning needed to take a new strategy as the coronavirus swept the globe.
When we started planning for the 2020 campaigns, and along the line, COVID-19, happened, and there was panic everywhere, rightly so. COVID-19 has changed how we do things. So the first challenge we had was, would it even be possible at all to distribute nets in the context of COVID-19? Nobody was sure. There was a bit of confusion, but in emergency situations, the first thing you do is to wear your thinking cap, and start thinking outside the box. Sometimes, like they say, you throw away the box, and come up with innovative ideas. So the team had a series of meetings, brainstorming sessions, and came up with a strategy that could be implemented in the context of COVID-19. And one of the key changes that you would observe is the single-phase, door-to-door integrated mobilization and distribution. That is innovative. That hasn't happened before. And the idea was to actually minimize contact and exposure, to ensure that people go in there, distribute nets, and come out safely, in terms of the beneficiaries as well as the campaign personnel.
We did it We did it in 2010, when we distributed about 1.4 million nets. We had it in 2017 when we distributed about 2.5 million nets. And now we are in 2020 campaign when we are expected to distribute close to 3 million nets. The strategies we have been employed in the past has been we mobilize people at the households by giving them net cards and then redeeming them at distribution points. But this time around, because of COVID-19, the strategy has changed. We are giving the mosquito nets at the households. We enter the households and give them mosquito nets.
Successful distribution of ITN is the culmination of every step described above and the ultimate objective of the SCM process. It must be done in a well-planned and orderly fashion. ITN recipients should each receive the ITN to which they are entitled as per the stated criteria campaign and routine distribution needs to be complete and accurate to show accountability and good stewardship.
We've also gotten support from the state through the SBC activities where we had the jingle airing done free on media house, on some media houses. We also had a lot of phoning programs. We had other different supports that we got from the state.
From what I have seen, having been around and monitored the process so far, I'm really very excited with the team. First of all, nets are being distributed and everybody is really very proud of this achievement. You know, that's a way of saying that we have not allowed the populace to suffer malaria because of COVID-19 pandemic. Therefore, that's a huge achievement.
Distribution personnel under the leadership of team leaders arrange and execute the distribution. They also document the distribution and report back to the logistics officer and project manager through predetermined channels. ICT 4D officers provide troubleshooting and technical advice to distribution teams on the use of the device. They need to travel across distribution points within their areas and remain in phone communication with all distribution teams throughout the distribution period. Health authorities participated in the monitoring of the distribution on behalf of the government and ensured that distribution follows government protocols and policies for ITN coverage.
An kawo mana gidajen sauro. Mun gode godiya muke bisa ga cizon sauro ta ishe mu wallahi yan anguwan Yalo, mun gode Allah ya saka da alheri. Maganan COVID-19 kuma Allah ubangiji ya yaye mana wannan cuta. Allah ubangiji ya kade mana shi, jarabawa ne kuma ya same mu kuma Allah ya kiyaye gaba.
Ka mana wannan abun ya faranta mana zuciya sosai. Ni da nake magana mu a Demsa ba karamin farin ciki muka yi ba, ana ka mana wannan abun sauro na gani ba sai ya rikice. Ina da yara guda 10, Allah sauro ya dauke min guda 2, Allah ya bar min guda 8. To muna muku godiya, Allah ya kara, Allah ya ba ku lafiya, Allah ya sa kuma ku kama na gado ma na maganin sauron.
Alhamdulillah na karbi nawa, na ji daɗi kuma masu rabawan su yi min bayani yanda zan yi aiki da shi. Suka can ajiye a inuwa dai na awa 24, wato kaman kwana ɗaya kenan. Bayan nan zan iya yi aiki da shi ni da iyalina da 'ya'yana duka mu kwanta a karkashin shi.
Ba abun da zan yi faɗa illa in ce musu na gode, domin lalle na san cewa suna da tallafi domin lura da rayuwar yara kuma a kiyaye su ga waɗansu cututtuka. Na gode masu.
Following the distribution, end process evaluation was carried out and M&E officers visited all or a random sample of recipient households to verify that recipients received the ITN and that they were using them correctly. This is done both to verify randomly the accuracy of the data contained in the recipient and inventory status reports and for ITN usage monitoring. The mosquito net distribution campaign is driven by broad ambitions for the elimination of malaria in Adamawa State and Nigeria at large. Just as darkness casts itself upon the sky at night, a net has been cast into every home in Adamawa State to protect the people of Adamawa State from mosquitoes that spread malaria by sleeping inside the net every night.